Hi everyone, welcome back to podcast Health Beyond Borders presents by MHTC, Malaysia Healthcare Travel Councils with Island Hospital. Okay, and where we talk about the things that matter for your health but don't always make it into the group chat. So I'm your host Afika Jalil, and today we're tackling a topic that's often whispered about, joked about, and even completely avoided: sex, hormones, and health. Okay, let's be real. There's a lot we didn't learn in school when it comes to our body, especially when it's below the belt. And today we're tackling. Today we're breaking the silence with experts who know exactly what's going on and what you need to know. And to help us unpack all this, we're joined by two incredible guests from Island Hospital, Penang. All the way from Penang. Ooh. Okay, and Dr. Devindran Manoharan, consultant urologist, and Miss Ling, CEO of Island Hospital. Welcome to both of you. Thank you so much for joining us.
Thank you.
Okay, I appreciate you came all the way from Penang to Shah Alam. And how's your day today? Okay?
It's good so far. All good.
How's your journey?
Good
Okay.
journey.
Fantastic.
Fantastic.
Happy to be here. Very
Happy.
excited.
Thank you so much. Thank you so much for being here. And before we start, I would like to get to know with our guest today. We start with Miss Ling, CEO of Hospital Island Hospital. So, would you like to, if you don't mind, to share about your background and how long have you been working in this industry?
Hi, Fika.
Hi.
Thanks for having us. Like I said, so excited to be here.
Thank you.
I'm Miss Lim, the CEO of Island Hospital, located in the beautiful island of Penang. I have been with the hospital, you would consider me a veteran. I've been in the hospital for more than 20 years. And have a lot of experience working in different parts of Island Hospital to develop our services and to continue learning how we can, what more we can do for our patients and how we can make our services even better.
Thank you. Okay, and let's proceed with Dr. Devindran Manoharan, consultant urologist. Can you tell me about your background?
Oh, yeah. Well, unlike Miss Lim, I'm not a veteran in Island Hospital. I'm quite one of the newbies. I've barely been there about 8-9 months. I'm enjoying myself. But I do have about 17 to 16 years of experience in urology and general surgery. I was previously attached with the Malaysian government, Penang GH, as the head of department. And prior to that, I practiced in Australia and many parts of Malaysia. And I'm very excited to join Island and bring my expertise and interest in men's health, particularly to the hospital.
Okay, thank you. So let's start with the first question. I'm going to ask the doctor. Okay, as we know, as a urologist, for me, all I know is urinary system problems.
Yeah.
Okay, and what exactly do urologists treat that people often misunderstand or never talk about?
So it's a great question. I mean, the most common perception that even my good colleagues and friends have is that we only treat men.
Yeah.
You know, when they talk about urologists, the first thing they go, oh, you only treat prostate, or men's health. But as urologists, we actually have a big spectrum of diseases. We do cover both men and female. I also have a keen interest in pediatric urology and anything in the genital urinary system. So that's from the kidney, the ureter, the bladder, the prostate, and in males, the male sexual organ. So we do deal with common things such as urinary tract infection to extremely complex conditions such as cancer. And even now, with a special interest in things that affect even healthy men, which is men's health. So it's a very vast scope of diseases that we do. And a unique thing about urology as compared to other fields of medicines, we're quite the pioneer in advancing medical technology. Minimally invasive surgery, the usage of lasers and robotic surgeries have all been pioneered by urologists. So as much as my friends and my colleagues do snigger, and yes, a bulk of our patients are men, we do treat men and women, and the scope of diseases that we cover range from your most common urinary tract infections to even the most complex of conditions.
I was about to ask if the urologists only treat men, but as you said just now, women.
Yes, yes. There's always this fine distinction between do they go to see a gynecologist or they go and see a urologist. Now, there are certain conditions that are managed by the gynecologist, but conditions that have a bit of background in the urology system. So, like ladies who do get common infections, recurrent urinary tract infections, they will commonly go and see a GP, receive some antibiotics. But why a urologist should investigate them? There may be a predisposing factor why they keep getting these UTIs. Things like renal stones, even things like cystitis. And there are certain conditions that predispose a lady to get frequent infections. So while it's assumed that we see mostly men, a lot of our patients are female. as well.
Female.
Yeah.
Oh, okay. Thank you. So I'm gonna ask Miss Lim. Okay. There's this idea that low libido, fatigue, or even erectile dysfunction is just a part of aging. Is that fact or fiction? What do you think? So we go back to our topic today: sex, hormone, and health. And what do you think about the question just now?
Well, I think it's fiction because I am a big believer in aging well. So it doesn't, there will be wear and tear as we get older. Of course, you can't be as a superhero and bounce back as quickly as you can when you were in your teens or 20s. However, we shouldn't just accept that there's nothing we can do about it. And there's a lot that we can do to improve the quality of life. In our industry, we spend a lot of time talking about quality of life and how we can age better,
Yeah.
age healthier, and a word that I like to use a lot, improve our health span, not only our lifespan, but our health span. I think that's really important. And sexual well-being and sexual wellness is a very important part of that. Although, in our culture, perhaps we don't talk enough about it, but
Yes.
doesn't mean it's not important and it doesn't exist, right?
You're the example for aging well for me. How come you've been in the hospital industry for 20 years? And so how, I was wondering, when did you start? When did you start working?
Okay.
If 20 years you've been working in Island Hospital, and how old are you right now? You look like 30, maybe 10 years?
Thank you very much.
32 or the same age as me?
Actually, 3 weeks ago was my 25th anniversary in Island Hospital. So I started as a fresh graduate in hospital operations. So I worked from the ground up. And when I attended my job interview, I told my boss, thank you for giving me this opportunity, but I might stay only 6 months because I want to pursue further studies. 25 years later, maybe I can't make it anywhere else. That's why I'm still in Island Hospital and having a fabulous time. And I think the passion that I feel for the job helps keep me energetic and hopefully looking young.
Yeah. Exactly. You look young. I feel like insecure being with,
No way.
with the skin, the hair is so pretty.
Of course, knowing so many top-notch doctors helps
yeah.
because I get a lot of good advice.
And back to the question that Miss Lim answered quite well. It is a common concept that men feel that, but what we want is these kind of topics, to bring the topics to men to understand that it's not necessarily aging. There might be underlying medical conditions that are resulting in that. So a man might go to work, come back every day, feels tired, and he doesn't go to see a doctor. He doesn't discuss it with anyone because he assumes, I'm just getting older.
Yeah.
But if he actually just comes up, we do a few blood tests, we investigate him, and he does have medical conditions that can be reversed, and that can actually things that can actually prolong his lifespan. That's aging well, but also with the right information.
Yes, true. Because there's, we can see out there's so many supplements to help getting with the tagline, getting younger, getting, even me myself, when I saw iklan atau advertising about the product that could help increase your libido, something like that, I would feel like, I don't want to talk about this. I don't want to hear about this because I rasa macam malu. I feel ashamed to talk about it or to admit that I need that. Okay. So what do you think about the mindset about the people like me who
Yeah.
is scared or doesn't want to talk about it.
Well, I think it's important. You've already made that first thing. You're aware about it. You want to have the discussion, but there's no medium or avenue for you to have this discussion, and that's what a lot of people do. They turn to social media.
Yes.
They turn to TikTok. They see advertisements that tell you, "Oh, this is going to prolong your life," and particularly with men, they have all these advertisements that or this special tea or coffee, and this is dangerous. If you actually go to our National Pharmaceutical Registry website and you see the list of banned medication, at least 70% of these medications are aphrodisiac or men's health supplements. The WHO recently came up and said that the counterfeit illicit sex medication industry is even larger than illicit drugs. It's overtaking, it's $1 million industry. And the concern we have as doctors is when you purchase these medications, we do not know what's inside. And whoever is selling their products do put pharmaceutical drugs inside. And the amount of pharmaceutical drugs are deadly and very dangerous. And it's a big field that there's not enough awareness. Social media is good. It allows people to bring up the topic. But the misinformation is the dangerous part,
So there is no actually a product or something that could increase your libido or the things that could increase the hormone health or
Generally,
is
there
or you need to feel healthy
Yep.
to have a healthy brain, healthy body to have that libido.
Yeah. So
Libido
the libido itself is influenced predominantly by hormones,
Yeah,
right?
okay.
So what we do when patients come to us and have these complaints, we work them out. We check their male testosterone. There is this condition called late onset hypogonadism, or better known as andropause, or the male menopause. It is a condition that is very common and a lot of patients come to us, but they have to be diagnosed well. Testosterone supplements are medications that I give a lot of my patients, but they're also medications that are very dangerous. Testosterone supplements can be got in the gym. I have so many patients who have just go to the gym and their PT is the one who gives them the testosterone. Now, if you take testosterone and you don't check your cardiac illness, you can be predisposed to get a heart attack. If you don't check your PSA level for prostate cancer, you can actually proliferate a cancer. So these are dangerous medications that are easily available and can seriously harm a patient. I've had patients who are now 30 and 40, but when they were 20, they kept getting testosterone supplements. They come to our clinic with, shriveled up testicles. They're unable to perform. They cannot have children. So it's a major problem, And that's why, opportunities are there for people out there to be aware. You don't need to go and get it from your PT. Come and see a doctor and I will give you what you need,
Okay, and we hear a lot about
testosterone supplements, right? Yeah.
from supplement to shots
Yeah.
to shady ads. When should someone actually get their levels checked?
So the
actually?
best is your friendly urologist in Island Hospital. We have a few, or anywhere, even in any clinic. You go to your general practitioner, explain to him. So the main symptoms that a man who has or needs testosterone supplements is lack of libido, erectile dysfunction, and lack of energy. So any man should go and see. Now, I mentioned andropause as compared to menopause. In females, menopause happens quite drastically.
Yes.
Whereas in men, the male testosterone reduces by 1% per year. So it doesn't hit them as a sudden event. It's a gradual process that happens. And differently among men and women, it hits men at different ages. Now, if someone's a healthy man, he's jogging every day, he has no chronic medical illnesses, he's possibly going to have good circulating testosterone till he's 60 or 70, as compared to someone who may be a bit obese, chronic kidney disease, diabetes and hypertension. They're all part of this thing called metabolic syndrome. And the metabolic syndrome is really common in Malaysia and it keeps increasing day by day. We in medicine, what we aim is not just to treat you, but to restore you back to what you were. Restorative therapy. It's the new field now, but it needs awareness, and people need to know who to go and when to come.
Yeah, it's very important to get to know your own body.
Yep.
Which when you feel a little bit different or you're not comfortable with certain parts of your body, you really need to seek help.
Yeah.
Yeah, betul.
I also believe that you
Yeah.
have to take ownership of your own health.
Yes, true.
And not just rely on only medication
Yeah.
or only
Supplement.
Exactly.
rumors or
Yeah.
gossips or
Essentially,
advice. Yeah,
taking the easy way out.
Yeah.
You know, you just want a pill or a jab, but you don't want to take care of your diet. You don't want to exercise. You know, you
Yes.
still practice
Yeah.
unhealthy habits and
Yeah.
complain to the doctor and say, "Oh, I'm all tired," but you know, you're not doing it. Can you give me a jab? You know, it's not going to work that way. You know?
Yes,
Taking
true.
ownership of your own health is important.
Okay, let's get back to our topic a little bit. I wanna ask if would you for Miss Lim finish this sentence? Taking care of your hormones is just as important as.
Taking care of your bank account. Because, like I said, we have to take ownership. We have to organize ourselves. I mean, like, say you have to pay your credit card or you need to pay your house loan. If you don't remember to do it, you don't do it regularly, you don't do it with some amount of discipline, put money aside, plan for it, then you're going to end up with trouble, right? So similarly, looking after your physical and mental well-being, I believe it's also an investment. Eat well, sleep well,
Yeah.
have good social relationships, and this thing that I feel is really very important, a purpose in life, have something you're passionate about, interested about, and that will kind of like keep you more on track towards having better quality of life. And then when you do have medical issues or you feel like you're not tip top, then you see a doctor, and I think then the doctor will be better able to guide you or to fine tune your physical health, be it with medication, be it with more detailed diagnostics to understand what is going on in your body.
Okay,
And
thank
healthcare
you.
is expensive.
Yeah.
You know, so you want to take care of
Yeah.
your wallet, take care of your health.
Yes.
Definitely.
Yeah, exactly. It is an investment in yourself, right?
True. And the same question for a doctor. Taking care of your hormone is just as important as.
Oh, she got the good, Miss Lim.
Okay.
So whatever I say after that's going to be a bit, So I'll have to say it's just as good as taking care of your health. You know,
Yeah.
it's the whole picture. You can't just say, I want to take care of this aspect of my health. You know, patients can't come to us and say, I'm just going to take care of my cardiac issue. You know, it's one whole package. It's everything. You know, that's why we try and educate patients as well. You know, a lot of times we see patients at the end point, when there's really not much that we can do, where we can only advise them on things to do to not make it worse. But what's important is the beginning. If you take ownership of your own health, you prevent this from happening. And it's important that, your body's trying to tell you something. There is a line that the penis is the barometer of your health. Because it's a bit off topic by erectile dysfunction. There's studies that show from the onset of men having an erectile function, it's 6 months till he has his first cardiovascular event and 9 months till his first stroke. So the body's trying to tell you something. So men who start experiencing ED, if they go and seek treatment somewhere else, they may, end up dying one day. But if they come early to a doctor and reinvestigate, we find out it's not that you have an erection problem. You have diabetes. You've got 3 blocks in your heart. Go and get this sorted out. And that's an important thing. So we can't just take care of the hormonal aspect. Look at everything. Your body's trying to tell you something.
I want to ask if my body is trying to tell me something that lately I feel like always getting angry easily.
Yep.
So is it berkenaan dengan hormone? Is it?
There's definitely an aspect to it,
Aspect.
because it's when we talk about hormones, the first thing that comes into most people's head is estrogen and testosterone.
Yeah.
But we have other hormones in our body. We've got cortisol, we've got insulin, and these drives a lot of emotion as well. There are a lot more studies now into dopamine in our brain. Even things like social media, they give short bursts of dopamine. Right, and when you remove this short burst of dopamine, what happens is your body goes down tiredness. So it is a very good point that a lot of our hormones play a part in a lot of other feelings, but it's not just the male sexual hormones; it's the whole thing that's there, and it's true.
It's true. Okay. So, our next question is, why do you think it's it's still so difficult, especially in conservative cultures, to talk about sexual health until it becomes serious?
Well, I think that the topic's difficult because we're a multiracial country. So being a multiracial country, we have different races, we have different cultures, and we have different religions. So there are three different aspects that we need to talk about. Societal norms drive this discussion, you know, and depends on who's discussing sexual health. Among men, even with men among themselves, they will never bring this up because the topic of sex is something that's a bit of pride, male ego.
Yep.
No man is going to tell his friend, "Oh, last night I couldn't get it up."
Yeah.
You know, it's not. It's sniggers. It's a joke, and it's laugh. But that's the problem that we have in our society, and that's at one aspect. And then we have another complete aspect with the younger children. You know, where they are exposed to so much things online, but nobody tells them what's right or wrong. Nobody tells them to understand their own bodies and hygiene and health and everything else. So it is definitely a problem. But I do see changes. We're willing to have the talk. More and more topics, more and more podcasts like this, radio shows, TV shows, where topics have been brought up. The question is, to get that information out there and to get the right information out there. But it is difficult, even with doctors and the patients, just for me to ask the patient, he has to look left, he has to look right. He's like, can your nurse leave the room?
Yeah.
It's a very embarrassing topic. But what we're trying to tell you, it shouldn't be a topic. It should be something that we discuss because there's a lot of ramifications. Sexual health doesn't just affect the husband, it affects the wife, it affects the family, the children, the whole relationship, but who's here to discuss it with, and unfortunately, that's when people take shortcuts. When you don't want to have the discussion or you're afraid to have the discussion, you take the easy way out. You go on TikTok and you buy a supplement that you don't really need.
Betul. And I admit that this is the topic that we often avoided,
Yeah.
fully avoided, because I'm one of that person.
Yeah.
And we always other than that, we always joke about it. And we can see a lot of people don't want to talk about it, so they just joke about it, which is it's actually very, very important for your health. It's a sex, hormone and health.
Yeah.
It's equivalent, which is sama kepentingannya untuk ketiga-tiga itu.
It's all one, your body's trying to tell you something.
Yes. Okay.
People feel segan.
Yeah, segan.
right?
Yeah, very.
Yeah.
Especially untuk wanita to talk about it and to be open with their husband, especially they wanted to say it, but they don't want to hurt their feelings, their partner's feeling.
It is. It's a very tricky discussion.
Yeah, betul.
Because the perception of what's supposed to be normal, they don't have anyone to ask.
Yeah.
Even among their own parents or relatives, they're shy. So it is. That's why we want to explain, and that's why it's good. Urologists, we don't just deal with men. We deal with the discussion. And a lot of times it's looking for medical conditions or things that can have that. When recently we were involved in writing the clinical practice guidelines for ED in Malaysia. It's only now, after so many years, there's actually a practice guidelines. And when we had the guidelines and we launched it in KKM at that time, it was difficult, to get people to get involved. There was the things like from the ministry, are you sure this is the right way? Are we teaching people, But in the end, it's did, and it's a start. I think more and more Malaysians are having the topic, especially in healthcare.
Okay. So we'll come back after this because the topic is getting hotter and hotter, getting sexier and sexier. So maybe we can take a break for a while. Okay, we'll come back after this.
From the shores of Penang, Malaysia, a world-renowned destination, a beacon in healthcare stands tall. Malaysia's largest contributor to the healthcare travel industry. One of 4 finalists in the prestigious flagship medical tourism hospital program. At the helm of the country's most innovative integrated medical hub, Island Hospital.
Welcome back to podcast Health Beyond Borders, presents by MHTC Malaysia Healthcare Travel Councils with Island Hospital. Okay, we are with our guest today, and I'm gonna ask Cik Lim. Okay, what's one thing you wish every man or couple in their 30s or 40s understand about hormones, sex, and long-term health?
I wish that couples will be able to have open conversations with each other, and the good, the bad, the ugly, because it's a mix of medical, psychological, emotional, so many aspects that make a relationship work. So the key to that is having open conversations, and with that, then I hope relationships can be strengthened, and then you can hopefully grow old together.
And to doctor, what are the often problems, the common problem when couples, or whether it's a wife or a husband came to you, come and see you, what's the common problem they always talk about?
Generally, I mean, once they've already decided to come and see me as a urologist, they're already open to the discussion, and it's straight to the point. It generally deals predominantly with erectile dysfunction and a lack of libido, which is a big problems as well. But they're problems that we need to investigate. We need to find out why this man is having erectile dysfunction. There are multiple factors, which ranges from psychogenic causes to endocrine disorders, blood vessel disorders like diabetes and hypertension, and even neoplasias and spinal cord compression. So it's my job to investigate this, because these are things that we can actually cure. And it's important. I appreciate it when the husband comes with the wife. When we have the discussion with both of them, so they don't understand it together. Most of the time, it rarely happens. And the one thing is that the couple or the husband should know that it's something that has answers. There are medications that we can help. We do have new forms of therapy, restorative therapy itself, which is a really exciting field. Every other time you come to medical or see a doctor, I give you a medicine, you go back, and all my medication does is control your symptom. Now we're in the field where we want to restore you back to what you were. Rejuvenation and restorative therapy. That's the next frontier in medicine, and we're very excited. I'm excited to be in a hospital at Island that encourages new technology, and we do have a lot of opportunities to help these couples.
Okay, I'm gonna add just one more question. Should sex is something that everyone should be avoid, or adakah ianya sepatutnya jadi sakit atau something that enjoy? Because I've heard before that sex shouldn't be something that menyakitkan.
It's
Okay,
completely
atau
true.
menyiksakan.
It shouldn't be painful.
It shouldn't be painful,
for both the husband and the wife. And there are certain medical conditions that cause pain. In men, there are certain men who unfortunately have certain abnormalities in the penis, that the penis is a bit curved, and it's actually really painful for these men to even have an erection. Similarly in female, there are conditions like vaginismus, where this unfortunate lady will have a condition where it's just painful for her to have intercourse, and it should not be. Right, there's a move, in physiology, and when we learn medicine itself, sex is considered for procreation. But after the 60s and the advancement of oral contraceptives and Viagra, it's moved on to understand it's important for the whole relationship in the partner. It's not just a biological act; it's a physical act of emotion and love, and it's important in the couple. Because as happy marriage, happy life, happy children, everyone's happy. And if there's one aspect that's not, each are going to blame each other.
Yeah.
And that's going to be a problem. The wife might be thinking it's normal because she doesn't ask anyone, and she suffers in silence. And as such, she doesn't want to be with the husband, and the husband gets upset, and he may, not want to be with the wife, thinking that it's his fault, and it's a big thing, and education is important. And that's what, there are conditions, and they're treatable conditions. You don't have to live with the pain.
Yeah, the important thing is healthy marriage, because when I'm angry, I don't feel like having.
Of course. Yeah.
It's all goes back to our brain or our hormones itself.
It's all one amazing system that's all connected. And small errors in one can lead to major errors.
Yes,
That's where we want to come in and help them.
Okay, thank you. And I'm gonna ask, when it, let's proceed with the next question. When it comes to sexual and hormonal health, what are international patients most curious about, and what are they most hesitant to ask?
I'll answer that from a not so medical point of view.
Yeah.
Like we said, a lot of stigma, a lot of segan, shy.
Yeah.
So very often when you travel to a different country, I believe that people are a bit more willing to share and talk about things that they may not talk about at home.
Do you think only in Malaysia that's people are
I
segan to
I
talk
don't
about
think
it?
so. I don't think so.
Yeah.
But it's like, when you go on holiday, you might go rock climbing or you might go whitewater rafting that you don't do here.
Yeah.
Why? Because it's a different environment. You feel
Yes.
like a bit more freedom to talk about and do things that you wouldn't normally do back home. So my view is that when patients travel, they are, by the time they travel with an intention to see a doctor, they've already recognized that, oh, I have this question in my head, I want to find an answer. So maybe I'm a bit shy to talk about it back home because maybe the doctor knows my family
Yeah.
or, the nurse maybe is
Yeah.
someone I might meet, right? I don't want to be seen going to a urologist office in my hometown.
Yeah.
Correct.
Okay.
So perhaps for what we do in terms of providing service to international patients, there's also that extra value add dimension of more confidentiality. Patients may be more open and willing to talk about things that they don't talk about back home.
Okay. And this topic are still taboo in many countries anyway.
Yeah.
What do you think?
Similarly, a lot of people go overseas to have plastic surgery,
Oh yeah.
right?
Yep.
Because they don't want other people to know, correct? So in that way, I think that there is also that type of feeling that if I go to a different country and consult a doctor in so-called a sensitive area, I might feel more open to talk about it and to seek treatment.
And in Island Hospital, how do you market sensitive service like men's health, fertility, or sexual awareness across different cultures? Is there any campaign or you guys in Island Hospital or brochures to educate people about this urologist? Okay.
Well, we have a lot of patients from Indonesia, especially, coming to Island Hospital for treatment. So a lot of our communication and a lot of our hospitality on the ground actually very warm towards our Indonesian patients and their culture and their language and how to communicate with them. Hopefully that will make them feel more comfortable in seeking advice from our doctors. So Dr. Dave has been with us for less than a year. I'm sure he can diagnose and communicate super well with Indonesian
Yes.
patients.
Yeah,
Yes.
it's my language is evolving, so much so that we do see local Malaysians. I do start speaking to them in Indonesian. Hey, kami dari Malaysia, jangan risau. But to just back to that topic about Miss Lim mentioned as well, I think the hospital is quite well versed in explaining to international tourists as well what are the facilities that are offered. And even in my short practice in Ireland, I realized that you see a whole barrage of tourists from all around the world, not just Indonesians as well. And they know the services that we offer. We have specialized packages and catering to them to give them the fastest treatment and the best treatment. So they are well aware of what they need when they come already, and they know we provide quality healthcare in a whole variety of fields.
And with Google, TikTok, and influencers shaping health perceptions, how does your hospital cut through the noise to build real trust with patients?
In our experience in healthcare, it is still about word of mouth and reflecting on our journey for Island Hospital. It's always been about word of mouth, just that nowadays with TikTok, Instagram, and all the various social media channels, word of mouth is quite scary. It multiplies even faster.
Yeah.
But classically, healthcare is still about
Most.
word of mouth,
Word of mouth, betul.
and word of mouth cuts both ways. It can be positive and it can be not positive.
Yeah.
So it is really important that we do our best to give each and every single patient the best experience that we can, so that they leave the hospital at least feeling satisfied with the service that we have provided them. So yeah, it is challenging to cut through the noise of social media, because when there's a bad comment, it's there forever. And you just have to do the best you can, and to continue to focus on giving that quality service to each and every patient.
Okay. I want to ask doctor, just lari sikit dari topik tadi, tapi I nak tanya, if Island Hospital provides IVF, is that urologist your...
So this is where we do have in vitro fertilization services. Where I come in is the men aspect. So we normally have a couple who've been trying for a few years. You know, the wife has seen a gynecologist, and the gynecologist will refer the husband to me. So we would do a few tests. We'll assess the quality of his sperm as well, to see is there good sperm, quality sperm as well. And there are certain situations where we assist in vitro fertilization by actually doing the biopsy and obtaining the healthy spermatozoas directly from the testicle. But my job is predominantly to help these men, because there are certain reversible conditions. You know, certain men with infertility, you know, when they come in and investigate, we have different types. It could be due to a hormonal cause, or it could be due to an obstructive cause in the system itself. So if it's an obstruction to the flow of the sperm, there are actually surgeries that we can do. There are medications that we can provide. And I've seen a lot of patients who've come in with infertility, and when you actually investigate them, they may have a small little tumor in the brain. You know, so I had this young man just a couple of weeks ago, and he had gone to many infertility aspects around the world, around Indonesia and in Malaysia, and he was told the same thing, you know, take a bit of vitamin C, you know, get healthy, but it was frustrating. You could see on his face, he was upset. So I did a few blood tests, and we noted one particular hormone level was a bit high, and I performed an MRI, and he actually had a little tumor in his brain, and this tumor was producing a lot of something known as prolactin, and that was inhibiting his sperm function. You know, and that's the beauty of the hospital. We send him over to see our expert endocrinologist, who referred him to the neurosurgeon. He got his solution sorted out. Well, it's a few weeks ago. I'm quite confident in a few months' time he'll be a happy man. So again, you know, it's investigating and going to see the right place, you know, to help yourself, you know.
Also that holistic approach. So I think doctors need to, and very important for patients to understand that doctors work as a team. So you may think that, fertility problem means it's a woman's problem, but no, it may be the man's problem, it may be a woman's problem.
Yeah.
It may be something related to the sexual organ, it may be physical, it may be mental, it may be something that you didn't even imagine, right? So we like to take the approach that, you know, we see it holistically, to basically look at all, leave no stone unturned, to look at all causes, and provide the best level of care for our patients.
This is like literally head to penis, right?
Yeah,
You know,
it's-
neurosurgeon to urologist.
it's I feel I cannot brain the, you know, but the doctor can do it.
Yeah.
The doctor can check. So that is why it's very important to seek for help from medical expert. And as for me, honestly, I don't have any medical background. I'm a degree in culinary art student, so medical is something that I always read or look at TikTok. Cari, sometimes I meet doctors, and I feel okay. When doctor told me about that, I feel like it's actually ada kaitan to.
It's all related.
Yeah, it's all related.
So that's also
why.
the same, like you're in culinary, you know, and same. So like if I want to know where it's somewhere good to eat, you know, we look at TikTok, we look at it. There's so many places, you know, and where do I choose? Then you call a friend, or you get information, and then word of mouth.
Yes.
You know, that tells you, all right, don't go to that restaurant, even though on TikTok got a lot of views. Go to somewhere else. You know, word of mouth and information. It's cutting through the noise. There's just too much noise out there.
Okay. Okay, thank you, Doctor and Ms. Lim. Okay, let's proceed with our next question. Sorry. Okay, is sexual and hormonal health a growing part of medical tourism? How is your hospital positioning itself to meet the demand? Macam hormonal health a growing part of medical tourism. Maksudnya orang macam maksudnya sekarang medical tourism macam dah jadi macam you cakap tadi, kita ada operation
Yep.
buat operation semua kan. Jadi
So,
dekat hospital Island Hospital untuk selain daripada urologist, apa lagi yang ada yang maksudnya offer?
so one of the very interesting areas that we want to develop is not only for sickness but for wellness. So looking at how we can improve the quality of life for people who are not classically sick. Okay, so for example would be men's wellness, where it may not be a classical disease type of diagnosis, that we can offer something to enhance the quality of your sexual performance, for example. It can be in terms of improving your appearance, be it aesthetic, be it improving the quality of your skin, your hair, your body contouring. It can be improving the quality of your dental appearance, that you want to have better looking teeth. So we are actually expanding into the scope of providing additional services to patients. Of course, we do a lot of serious work in the hospital, be it cancers, tumors, heart surgeries. However, I am a strong believer that we want to be able to improve the quality of life for people, not only when they are sick, but also when they are well. And what more can we do for them? Okay, that's what we talk about, taking ownership of your health, not waiting until it's too late, getting proper advice, proper professional
Advice.
guidance and advice
yeah.
from the actual experts, not only ChatGPT.
Yeah.
And
That most of people use right now.
yeah, that's
current-
right.
yeah.
That's right. So we want people to participate in having this quality journey with the hospital. So I, for one, believe hospital is not only a place for sick people.
Yeah.
It is a place for people who want to take charge of their health, and what more we can do to guide them and be with them on this journey.
And I think also having the newer technologies that are available. You know, while certain centers may, tell that this is what we want, but in Ireland we have the facilities and the technology to offer you that treatment. You know, we do have not just technology that we use to treat cancers. We have technology now to prolong your life, essentially, or improve your quality of life. And that's something that is the forefront, because as you mentioned about health tourism as well, we do know other centers that are available out there that are men's centers as well. But the unfortunate thing is that they're not proper centers, they're not run by urologists. And essentially what I think the main topic today is that your whole body's connected. You can't just come and see me and I tell you the problem. You essentially will have to see another doctor as well, a cardiologist or endocrinologist, and work on treating everyone in one whole holistic way.
When it comes to sensitive care like sexual awareness or hormone therapy, trust is everything. Yeah. And what makes Island Hospital the go-to destination for patients seeking privacy, expertise, and world-class care in one place?
Well, I would say, being new now, I'd say the years of experience they have, the established center, this amazing team of qualified surgeons and specialists,
And all the technologies Dr. said
everything,
just now.
as someone who's new into the field, to be in a hospital that you have every subspecialty, coming from a tertiary government hospital where your treatment's limited. I can't do this there because I don't have that. But when you come to somewhere like Ireland, which has everything, the opportunities are endless, and that's what we have that sets us apart.
Okay. If Island Hospital sexual and hormonal health service had a tagline like a movie poster, what would it be?
Yeah, I thought
Balancing
about that.
hormones, saving relationship.
Yeah, I thought about that for a very long time, and I would say the tagline would be in sickness and in health. We are there for you.
Wow, it's like a vow.
Yeah.
It's like a vow.
Yeah.
For better, for worse. Again, can I hear it again? Your tagline just now.
The tagline would be in sickness and in health, we are there for you.
Wow. In sickness, in health. Okay. Thank you, doctor. Okay, so thank you everyone. We'll come back again after this. Stay tuned.
A leading quaternary care provider that was established in 1996. With a team of over 80 full-time specialists across a myriad of medical and surgical specialities and subspecialties, complemented by a wide range of state-of-the-art medical technologies. Island Hospital is an internationally accredited hospital equipped to provide an extensive array of offerings, including core expertise in oncology, cardiology, neurosciences, gastroenterology, orthopedics, and general surgery.
Welcome back to Health Beyond Borders, presents by MHTC, Malaysia Healthcare Travel Councils. Okay, with Island Hospital today, we have Miss Lim and Doctor. Okay, so let's move forward. Okay, we're gonna ask about. I was actually don't really clear about the IVF just now, Doctor shared, and I want to ask if Island Hospital provides a treatment for. Should I call it treatment atau treatment ke macam?
Yes, treatment. So
treatment for IVF.
We do.
And
And the main I understand. So it's the gynecologist. So the women's doctor, who is an expert in women's field, he will be the one who does the in vitro fertilization. But in order for IVF to work, there has to be good quality sperm as well. So it's also the male who has to be investigated. I'll give you a recent example of a gentleman that I saw, and he was previously married and he had children, and he remarried to his younger wife, and this poor younger wife was subjected to multiple treatments everywhere because they couldn't get a child. And when the gynecologist brought it up with the husband and said, maybe you should be investigated, he took it in a very affronted manner, and he said, oh no, my ego, I'm a man, everything's good with me, why should I be investigated? And we was lucky because the gynecologist insisted and said, you need to be checked. And when he came and saw me again, the whole tone was very, oh, there's nothing wrong with me, it must be this. And the poor lady looked very upset and sad. And after a few investigations, I managed to find a little condition, which is called a varicocele, right? It causes the veins in the testes to be a bit dilated. And this causes the quality of the sperm to be poor, So he actually had this, when we checked his sperm, we realized there's this syndrome called OAT, where the sperm is low motility, it's not good quality, and it doesn't have enough number. The fortunate thing for this man was after the surgery, we were able to retrieve and get his sperms back to normal. But the main discussion here was the poor lady, who psychologically would have been, thinking that she's less and this, and the man who just didn't want to get checked up because of his ego.
Yeah.
Right? So again, yes, they see a gynecologist, but being a holistic approach of medicine that we have is that when you come and see us, we work as a team. And that's why it's good to come to a center like Island where we have all the specialities, or instead of just going to one particular gynecology center where you might not have a urologist.
Okay, and I might sound feminism a little bit right now, so it's very important for you guys to check and seek help and stop blaming just for one side, for a woman itself. Because
definitely.
Kesian lah
Exactly.
kan, for women that always kena take the blame.
And it's now that we realize how much mental health is important, and physical health affects mental health, right? And it's a whole thing. Mental health and mental health among men and women is not a topic that we discuss enough, and more people suffer in silence, and it is becoming a bigger issue.
Can I say that the mental health berkaitan dengan hormones?
Mental
Or
health.
it's
It's all
very big.
It's it's a chicken and egg thing. Which came first?
Yeah.
If your mental health is not good, if you're depressed as well, your hormones that you need to increase and elevate your mood, such as your dopamine, your serotonin, is all going to be low. And that's going to make you even more worse, when you don't eat, you don't take care of yourself, you're
Yes.
not healthy, and it's a whole vicious cycle. But if you eat well, you're healthy and all that, eating well, exercising increases these hormones, it increases your serotonin and dopamine. It makes you feel better. So you feel better, you're more active, you're happier with your partner, so it's a big thing. And that's the whole discussion, which I'm really glad we're having this podcast, to talk about health being not just about diabetes and hypertension, mental health and hormonal health. It's all correlated.
Yeah, mental health is very important that not much people talk about nowadays. Yeah.
Maybe that could be the next podcast,
Gonna take note on that. Okay, lastly, we're gonna ask Miss Lim, why Island Hospital?
Why not?
Why not?
We
Yeah,
are
why
the number one medical tourism hospital in Malaysia. We have close to 30 years of experience.
Wow, I've heard before it's 25 years. Now it's 30 years.
So we are very experienced hospital for looking after our local community, plus our healthcare travelers. And over time, we work very closely with MHTC, with other stakeholders in the industry, to keep pushing ourselves ahead to do more and more, expand our services, bring in new talent, new technology,
Yes.
invest in our people. So last year, 2024, we treated close to 250,000 international patients at
Wow.
Island Hospital.
What an achievement.
So it is something that we are very passionate about and want to continue to be the market leader and to continue to be the destination of choice for both our local as well as our international patients. It's a showcase of Malaysia healthcare.
Okay, after this, when I go to the Penang, I'm gonna look for Island Hospital and show my kids that the number one hospital in Malaysia. Okay, so yes, Doctor, want to add anything about
I
this?
think,
Why
why
Island
it's
Hospital?
perfectly answered. But
Yeah.
I think more importantly, from a clinician point of view, especially someone who's new and seeing the whole hospital practice, to actually work as a clinician, to work in a center where the sky's the limit. You're only limited by your ability. You're not limited by technology. You're not limited by lack of resources. Whatever facility that is required is there. Whatever new cutting edge technology that previously, when I used to go for conferences as a younger doctor, and you hear people internationally talking about this technology and this laser and that scope, and I always sit at the back and I was like, wow, I wish that one day I could have that, And then you come back and you work in primary healthcare where your resources are limited and you can't offer your best. But then when you finally do come and work in a hospital where the only limitation is your own ability, and that's fantastic for patients as well, So whatever the problem they may have, we do have the solution and we do have the team to offer that solution.
So as a number one hospital in Malaysia, when I heard about that, I would think about, the price must be wow, that right? But what do you think about? What do you want to say about the price? Or in Malaysia, we have our ceiling market price for every treatment or every surgeries. So what would Miss Lim kupaskan tentangnya?
We pride ourselves in being best in class. Best in class meaning that we are very good at what we do, and that doesn't necessarily mean that we will be the most expensive at doing it, because what is important to us is value, providing value to our patients. And that's value is not only about how many RM it is, but it is about doing a good job and doing our best.
Okay.
And that, as a Penangite, we're always looking for value, right?
Oh yeah.
A finalist of the prestigious flagship medical tourism hospital program. We look forward to supporting the nation's effort to provide the best Malaysia healthcare travel experience. Through the years, we have gained prominent awards and accolades locally and internationally in recognition of our commitment to delivering excellence in patient care, touching the lives of our patients and employees whilst giving back to our community. Rest assured, the best is yet to come. We are committed to synergistic partnerships and continuous investments in expanding our centers of excellence, enhancing our expertise, facilities and equipment, and enriching the patient experience. We aspire to continuously pursue medical and service excellence with our patients, both local and foreign, at the heart of what we do. Embark with us on a transformative journey in shaping the future of healthcare. Let us build a brighter and healthier future for all at Island Hospital.
And that wraps up this empowering and eye-opening session. A huge thank you so much. Thank you. A huge thank you to Dr. Devindran and Miss Lim for joining us today. Thank you so much. And before we end this footage, okay, I would ask Miss Lim and Doctor to cakap sepatah dua kata to end this session.
Okay, so actually, first and all, I'd like to thank you for actually inviting me and Miss Lim here to be on your podcast, to give us this avenue to speak. And I think it's important. And when I saw the topics, I was very glad, that it's a topic that's dear to my heart. And I feel it's a topic that we do not talk about enough.
Yeah.
And to avoid the jokes and avoid the sniggering, it's a topic that's important, because many times I have seen, very young patients who have sexual problems and look for alternative sources and don't get better. But we actually investigate them and find they've got chronic, life-threatening illnesses, and we actually save people's lives. There's nothing, more than that. And topics like this and discussions and forums like this is what we get people doing. And just now Miss Lim had a really nice tagline, so I think I might steal it from a very famous president, but allow us to make men great again, so that's what I want, so it's a bit different, but we'll follow along, our dear Trump.
Okay, so for Miss Lim,
Thanks, Vika, for having us today. It's really been such a interesting experience to speak about what we do in the hospital and what we are so passionate about. And we look forward to extending our hospitality to all our patients when you come and visit us in Penang.
Okay, yeah. Okay, thank you. We are truly honored to have you here and grateful for your expertise and insights. It's been an honest and important conversation, truly. Okay, thank you everyone for watching. Don't forget to subscribe our YouTube channel and see you guys next episode, Health Beyond Borders. Bye.
Thank you.
Bye.
Bye.